All right, so quiet inspiration is sitting there quietly inspiring, passively expiring with only the diaphragm. The diaphragm contracts and lowers, displacing your abdominal contents, so pushing down on the stomach and the intestines to increase the vertical dimension of the thorax, increasing the volume of the lungs. And then when the diaphragm relaxes, your stomach and your intestines that were squished down by the diaphragm push back up on it as it relaxes and it resumes its original position. So that is a passive expiration. You're not using any muscular effort to raise the diaphragm to decrease the volume of the thorax. If you're going to increase the amount of inspiration above the amount of inspiration you can have using only the diaphragm, as I've already said, this is where your accessory muscles of inspiration come into play to really elevate and flare out the rib cage, increasing the thorax in the transverse dimension, while also the diaphragm is pulling down and increasing the thorax in the vertical dimension. So quiet inspiration is performed with only the diaphragm without accessory muscles. But for more active, for more forced inspiration, you need the accessory muscles to come into play. Some of the primary accessory muscles of inspiration are the external intercostals. These are muscles that originate at the inferior boundary of each rib, and then they reach down to grab the superior boundary, the superior edge of the rib below it. So if you can imagine looking at this, all these fibers here, they're originating on the bottom of each rib, and they're reaching down and they're grabbing the top of the rib below it. So that when you contract all the external intercostals simultaneously, they culminate in elevating the rib cage and pulling all the ribs up and flaring them out. Close to the sternum, so if you look at this illustration, you can see that the external intercostals, they don't get around the sternum. So they stop around the chondral portion of the rib cage. But if you followed the external intercostals all the way back, you would see that they go all the way back to be close to the vertebral column. But you can see in this illustration, they leave off when they start approaching the chondral portion of the rib cage. There is internal intercostals that oppose the external intercostals. So whereas the external intercostals are all pulling up on the rib cage, you have internal intercostals that directly oppose them, and for forced expiration, they pull down on the rib cage. We're going to come back to those. But there is a portion of the internal intercostals that is around the chondral portion of the rib cage, right in here. And this is known as the chondral portion of the internal intercostals. And whereas most of the internal intercostals activate and contract for expiration, to pull the rib cage down, to decrease the volume of the lungs, to cause air to flow out of the lungs. The chondral portion of the internal intercostals contracts and activates during inspiration. And so they tighten up around the sternum to help keep the sternum vertical. So to keep your sternum from just sort of hinging out like that. They assist in inspiration, is what I'm getting at.
The origins of the external intercostals are from the inferior borders of the ribs above. The fibers pass obliquely and inferiorly to insert onto the superior borders of the ribs below. The external intercostals elevate the rib cage during inspiration. They are innervated by the intercostal nerves. The origins of the external intercostal.
So this gives you just a 3D illustration of what the external intercostals look like. As you can see here, like I said, they are not around the chondral portion of the rib cage. But the internal intercostals are around that portion of the rib cage. All right, so moving down into some muscles of the back. So we're still on muscles of inspiration. The accessory muscles of inspiration, they can be any muscles that reach down from another part of the body and attach to the rib cage. Because any muscle that's reaching down to the rib cage, if it contracts, it can assist in elevating the rib cage. And elevation of the rib cage is what happens during forced active inspiration. Okay, first group that we're going to cover is the levator costarum. You have two sets of levator costarum. Levator costarum brevis, meaning brief, and levator costarum longus, meaning long. So if we look at this muscle right here, you can see that it originates on a vertebrae and it courses down to insert into the rib below it. This is the levator costarum brevis. Originates on the vertebrae, the thoracic vertebrae. It reaches out and it inserts into the rib below it. So if this muscle reaches down to the ribs, when it is contracted, it's going to elevate the ribs. It is going to levate, meaning elevate, costarum meaning ribs. So the levator costarum brevis. If we were to look at this and I was to point out, okay, you have another set of muscles here that also originates at the vertebrae, the thoracic vertebrae, but courses down, skips a rib, and then inserts into the rib below it. That is the levator costarum longus. Both of these groups of muscles reach down to the rib cage from the vertebral column. So if they're reaching down, they're going to, when they're contracted, elevate the rib cage. They're not going to pull your vertebrae down. You have two sets of muscles, the serratus posterior superior, which we're going to talk about here, and the serratus posterior inferior that we're going to talk about when we get to the muscles of expiration. But looking at this muscle, you can see that it originates at the vertebral column. It courses out laterally to insert into the ribs below. Courses way out to insert into the angles of the ribs. So when the serratus posterior superior is contracted, it is going to elevate the rib cage. So the word serratus, this means like a serrated knife. it's this jagged shape right here. So any of the muscles with the word serratus, that means they're giving a jagged shape. And if I said to you, serratus posterior superior, where is this located on the body? Even if you didn't know anything else, you could know serratus posterior, it's on the back, and it's the superior, so it's on the top of the back. Serratus posterior superior. You have the sternocleidomastoid, which is this muscle. So you see this muscle right here runs from the manubrium up to the mastoid process of my skull, which is this bump right here behind my ear on my skull. And I have two that go from here down to here. So if I contract them both simultaneously, they can contribute to the elevation of the rib cage. If I only contract one, it is going to draw my head towards that side. So bilateral contraction, meaning contraction of both sides of the sternocleidomastoid simultaneously, is going to assist in elevating the rib cage because they run from my skull down to attach to the manubrium, and also it has a little head that you can see right here that is attached to the clavicle. There are three pairs of muscles that we refer to as the scalenes. They're the anterior, the medius, and the posterior, or anterior, middle, and posterior. And they're illustrated here. You can see that it's sort of, they're at this angle between the cervical vertebrae and your ribs. They look like anterior, medial, and posterior. So running from the cervical vertebrae down to the rib cage, they could, if the scalenes are contracted bilaterally, they're going to work to elevate the rib cage, especially the anterior and the middle scalenes. The posterior scalenes are sort of angled, don't have a great angle for being able to elevate the rib cage. The posterior scalenes are more about contracting and pulling your neck this way, or contracting and pulling your neck this way. So ipsilateral contraction of the posterior scalene is going to tilt your head, tilt your neck towards the side of the contraction. The anterior and the middle scalenes, they have a better angle for assisting in elevation of the rib cage if they contract bilaterally. If the anterior and the middles contract unilaterally, your head will rotate. It will assist your head in rotating towards the side of the contraction. So essentially, they assist the sternocleidomastoid in rotating the head when there is a unilateral contraction. And the head will be rotated towards the side of the muscle that is contracting. And this is a great illustration of the scalenes.